I will be trying to put a video, okay? Excellent. So you cannot select the one that you like most or probably put in that way. Selamat pagi semuanya. Terima kasih sudah bersedia mengikuti pencerahan saya hari ini. Sebelumnya mohon maaf karena tidak bisa hadir secara live berhubungan karena jadwal penerbangan saya kembali dari Dallas, Texas ke San Francisco, California dirubah mendadak sehingga terjadi bentrokan waktu. Adapun kalau Anda mendengarkan rekaman ini, saya mungkin sedang berada di dalam pesawat menuju ke San Francisco. Nah, saya baru selesai mengikuti the Annual American Lifestyle Medicine Conference in Dallas, Texas. Saya Dr. Rusli Harsono. Selain sebagai Clinical Associate Professor of Pediatric and Pediatric Critical Care Medicine di Stanford University School of Medicine di California, saya juga adalah Kepala Pendidikan Dokter Lifestyle Medicine dan Direktur Community Events of Stanford Lifestyle Medicine. Adapun topik pembicaraan saya kali ini sesuai tema ini adalah Flip the Metabolic Switch, Lifestyle First, Diabetic Care in 2025. I have no financial conflicts of interest to disclose. I'm grateful for the 2024-2025 Stanford Community Grants that support our lifestyle medicine's outreach efforts. Now, by the end of these sessions, you will be able to summarize the modern understanding of type 2 diabetic pathophysiology, integrate the 2025 American Diabetic Association Standards of Care Lifestyle Medicine recommendations, and apply targeted lifestyle medicine prescription for glycemic control and remissions. We'll also discuss diabetic self-management, education and support, medical nutrition, therapy referrals, continuing glucose monitoring, diet coaching, and how to identify patients who can safely undergo aggressive lifestyle medicine intervention. Here today, diabetic impacts over 537 million adults globally, a number that has tripled since 2000. The burden disproportionately affects low and middle income countries, including Indonesia, where almost 3/4 of cases are undiagnosed. And worldwide, we projected to reach nearly 800 million people by 2045. This isn't just a medical issue, it's a global system challenge. We once thought that diabetic type 2 was purely genetic or inevitably with aging. We know now that diabetic type 2 is heterogeneous by nature and that patients reach hypoglycemic through different biologic routes. From a lifestyle medicine perspective, type 2 diabetics reflects is predominantly a disease driven by ectopic fat depositions, chronic energy excess, and insulin resistance. And critically, these processes are reversible. Roy Taylor's work shows that diabetic results from twin cycles: liver fat driving hepatic insulin resistance and pancreatic fat impairing beta cell function. Reducing liver and pancreatic fat can restore normal glucose control. This means diabetic is not purely progressive, it can be interrupted, and the good news is reverse. Chronic hypoglycemia leads to micro and vascular complication, neuropathy, nephropathy, retinopathy, cardiovascular diseases, strokes. But the exciting part is that lifestyle interventions significantly reduce this risk and then often more actively than medication alone. Lifestyle medicine is evidence-based, not a wishful thinking. Its 6 pillars: the nutrition, movement, sleep, stress management, avoidance of risky substances, and social connection, directly target the root cause of type 2 diabetic. These pillars act through epigenetic microbiome transformation, inflammation reductions, and improved metabolic flexibility. The next couple of slides, let me show you some evidence on the impact of lifestyle medicine in type 2 diabetic management. Adventist Health studies show us that vegetarian had 70% lower incidence of type 2 diabetic and added approximately 6 years of life expectancy. These are long-term, real-world human data showing the profound effect of dietary patterns. These, these studies actually shows that lifestyle managements outperform the medications like in managing diabetic patients. Study studies of identical twins, same genetic, showing that 8 weeks vegan diet outperform an omnivorous diet in LDL reduction, insulin sensitivity, and weight loss. Same genes, different lifestyles, different outcomes. So you are really what you eat. The meta-analysis confirmed a 50% reductions in progressions of diabetic with lifestyle interventions. This RCT in 2022 among older adults shows significant HbA1c reductions, medications deprescribing, and improved quality of life. This graphic shows significant weight reductions on the intensive lifestyle group, and so was the visceral body fat. The direct trial found out that 32% of participants achieved remissions in 2 years and without medication, and that saved the healthcare system over 1,300 pounds sterling per patient. So lifestyle medicine isn't just clinically effective, it's financially responsible. Now we are shifting from model of slow the decline to a new model, prevent, reverse, and achieve remission. Lifestyle is not complementary therapy. It is first-line disease-modifying therapy. How does lifestyle reverse diabetic? Through caloric reductions, energy deficit, increased mitochondrial activations, improvements in liver fat, and decreased inflammations. This directly reverse the 2 cycles we mentioned before that we discussed earlier. ACLM, American College of Lifestyle Medicine, proposed the concept of diabetic remissions in 2009, which requires a blood glucose level on par with healthy individual without diabetic to be categorized as complete or prolonged remissions. In 2020, American College of Lifestyle Medicine formally endorsed remissions as a clinical goal, best achieved through a whole food, plant-based diet pattern combined with consistent physical activity. This consensus provides 131 statements guiding clinicians on diet-specific strategies, monitoring weight loss considerations, and policy advocacy. It is a comprehensive roadmap for lifestyle-focused diabetic care. American College of Lifestyle Medicine in 2022 introduced these proclamations of type 2 diabetic Bill of Rights as well. Now, I'm very excited today and then to share the newest July 2025 American College of Lifestyle Medicine guideline on lifestyle medicine interventions for type 2 diabetic and pre-diabetic. This guideline is groundbreaking because it reaffirms lifestyle medicine not as an optional, not secondary, but as a first-line therapy. And perhaps most important, it tells our patient that remission is possible. So there is hope. So this is hope-driven, evidence-based medicine. Now let's visit the latest glucose-lowering medication in type 2 diabetic overall approach from American Diabetic Associations. The first line therapy here, circle in red, is metformin and comprehensive lifestyle management. So that's lifestyle. Standard Diabetic Care Book 2025 from American Diabetic Association recommended lifestyle assessment and management here. And again, that's lifestyle. The consensus statement by the American Associations of Clinical Endocrinologists and American College of Endocrinologists on the comprehensive type 2 diabetic management algorithm as shown here, and that was developed in 2017. Again, it stands out with lifestyle therapy. And again, that's lifestyle. Now, here is the quick visual summary of the newest July 2025 American College of Lifestyle Medicine guideline on lifestyle interventions on type 2 diabetic and pre-diabetic. Now, it is evidence-based. So the evidence grade of the recommendations is categorized into 5 different criteria, from the highest of strong recommendations to the not applicable criteria as shown here. So there are 6 pillars of the foundations of lifestyle medicine: nutrition, plant predominant or plant forward diet, physical activity, restorative sleep, stress management, social connections, and avoiding risky substance. What I love about this framework is that it helps us see the whole person. Next coming slide, we will discuss on the 4 key action statements that cover all these lifestyle medicine pillars. Let's start with the very first one. The key action statement has strong recommendation. It's simple but powerful. Clinician must advocate for lifestyle intervention as first-line management. Our confidence shapes the patient's confidence. We walk the talk. When we believe lifestyle medicine works and the evidence is overwhelming, our patients feel empowered to make changes. The second step is like assessing where the patient is starting. We look at their diet, the physical activity, the sleep, stress, social support, and substance use. I'm sorry for the background noises. I hope you guys still can following me. Awesome. I apologize for that. Uh, I, I'm doing this as I'm at the conference room, so you're gonna hear a lot of background noises. I hope that wouldn't distract everyone so much. And then so even pre-validated tools help us identify strengths and opportunities. This is how we personalize care rather than giving one-size-fits-all instructions. Now, next, we choose priorities together. Shared decision-making increases engagement and success. We help patients create SMART goals, goals that are specific, measurable, achievable, relevant, and time-bound. Our role is to guide and then not to dictate. Exercise is not just helpful, it is therapeutic. So the guideline recommends both aerobic and resistance training using the FIT format as shown here: frequency, intensity, time, and type. Strength training is especially valuable because muscle is a metabolic organ. The more muscle we maintain, the better insulin works. Sitting for a long period increases insulin resistance, even in people who exercise. So create a smart goals of movement. So we encourage simple movement breaks, like walking for a few minutes, standing between tasks, or stretchings. This small step makes big metabolic difference. Sleep is one of the most overlooked drivers of diabetics. Poor sleep increases cortisol, appetite, and insulin resistance. We should screen for sleep apnea, circadian disruptions, and insomnia. For shift workers, like many of us in healthcare, this becomes even more critical. For pre-diabetic, the guideline emphasizes whole food, plant-predominant eating patterns. This approach is rich in fibers, low in caloric density, and deeply anti-inflammatory. We emphasize on whole food, plant predominant, minimally processed, high fiber, colorful, water rich, and adequate fluid intake. Food must also be culturally aligned. A great plan is one the patients can actually live with that. People with type 2 diabetes, whole foods, plant predominant eating support both management and remission. We now have substantial evidence that dietary interventions can lower HbA1c, improve insulin sensitivity, reduce medication needs, and help people regain metabolic control. This is one of the most inspiring part of the guidelines. Tailored nutrition sense of diabetic type 2 management rather than remission goals starts from assessing and clarification, individualized based on cultural background, preferences, and social context. Design smart goals, educate and support, monitor, track adherence, outcome, and modify approaches as needed. This is one of the most inspiring part. And then now, healthy foods are everywhere, as you can see here, at the different continent and different countries. I was talking about social connection is medicine. Patients who have support from family, peers, groups, or coachings do significantly better. Lifestyle change is hard to do alone. It's much easier when we do it together. Encourage support social connections from family, peers, lifestyle medical professionals to sustain behavioral changes. Diabetic is not only physical, it affects mood, energy, and mental health. Anxiety, depression, diabetes distress are very common. Screening tools like PHQ-9, GET7, PID, DDS, PSS help us identify who needs support. Identify or refer to psychological care. Recommend CBT or mindfulness-based interventions. Mindfulness and cognitive behavioral therapy, CBT, improve both emotional well-being and glucose patterns. We screen for tobacco, alcohol, and recreational drugs, not from judgment, but from understanding how they interact with glucose, stress, and medications. Non-judgmental conversations can open a door to a meaningful change. Education alone doesn't create change. Coaching does. Motivational interviewing, lifestyle coaching, and continuous glucose monitoring guided feedback help patients understand the lifestyle glucose relationship in real time. Enable person-created change using coaching, CBT, motivational interviewing, and technology-based tools. These tools support long-term success. Lifestyle transformation requiring follow-up. This is a strong recommendation. The guidelines recommend structured touch points, clear expectation on visit frequency, monitoring, and adjustments. Establish a structured follow-up, plan of for frequency, durations, and pharmacological adjustment. Lifestyle medicine transformation requiring very strong follow-up, and then this is very strongly recommended. As lifestyle improves, medication needs often decreases. We de-prescribed, reducing doses, simplifying regimen, and preventing hypoglycemia. For many patients, the goal is remissions, restore metabolic health, and minimal medications. De-prescribe or adjust medications as lifestyle improvement occur. Implement stepwise reductions and continuous monitoring. Now, to summarize, the ACLM 2025 guideline places lifestyle medicine exactly where it belongs, at the center of type 2 diabetic care. We now have a strong, evidence-supported framework that empowers patients and clinicians. A plant-predominant diet, physical activity, sleep, stress reduction, social support, and eliminating risky substances. These are powerful tools that can prevent, treat, and in many cases, reverse type 2 diabetic. Our message to patient is simple. Your body is capable of healing, and we are here to support you every step of the way. Untuk pembelajaran lebih lanjut tentang lifestyle medicine, Anda bisa dapat informasi lebih mendetail dari American College of Lifestyle Medicine, termasuk artikel terbaru konsensus yang baru kita diskusikan. Nah, Anda sekalian diundang untuk melihat informasi gratis tentang lifestyle medicine juga di Stanford Lifestyle Medicine. So, let's live our best life. Mohon isi survei berikut tentang pembelajaran ini dengan scan QR code ini. Pada akhir survei, Anda dapat mendaftar secara gratis untuk mendapat newsletter dari Stanford Lifestyle Medicine. That will conclude my talk today. And again, I apologize that I am not able to actually come onto the screen live as I'm actually on my flight back. Thank you so much. And I'll take questions to the organizer. Thank you.